Good evening, everyone. Greetings of the day. I'm Sayukta from beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. Few of the common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern. Acne is a very common skin condition that can impact anyone. Whether you are a teenager or an adult, this skin complaint is no stranger. Knowing the various types of acne can help you to treat the condition better. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. It is one of the most common diseases affecting humanity and quality of life. It goes beyond just being a skin ailment to various psychological disorders such as depression, anxiety, stress, and low self confidence. Hence, it is important to know about the holistic treatment approach for this ailment. Despite its prevalence, few people know that June is Acne Awareness Month. Acne Awareness Month was launched to combat the negative stigma surrounding this very common skin condition and also to be aware of treatment approach of acne or acne scars and pigmentation that it leaves. So let's connect today with our skin expert, Dr. Nandita Rai, live from Siliguri, West Bengal, to talk on acne and scar management. Dr. Nandita Rai is one of the leading young dermatologists and cosmetologists in Neo Skin Clinic. She is practicing there and she has more than 5+ years of experience in this field. Dr. Nandita has a vast experience in both cosmetic and dermatology treatment. She has done her MBBS from Huganla State Medical University, Ukraine, and MD from Uzhhorod National University, Ukraine. She is member of Global Cosmetic Surgery, Dermatology, Aesthetic Surgery International League. Her area of interest lies in psoriasis, eczema, acne, pigmentation treatment, various skin infections, hair problems, and also aesthetic and cosmetic dermatology. She is proven hair fall, hair loss, dandruff, the management of all these, alopecia, erythra, tattoo, mold removal surgery, skin biopsy, etc. A very warm welcome to you, Dr. Nandita Rai. It's a pleasure to have you with
So
us.
much. Thank you
So,
so much
Doc,
for that introduction. And I'm very happy to be here today live on Facebook on Spotless Beauty Skin page.
right,
Thank you so
beautiful
much.
spotless skin page, right, doctor? And it's our pleasure actually to have you with us. And today we are going to talk about a very important thing, a big concern for people, which is, acne and scar management. So to start with, doctor, first of all, I would like to know, that what is acne? If you can tell us what is acne, what are the various types of acne?
Okay. So acne is a long-term skin condition which occurs because of production of oil, that is sebum production, which clogs the hair follicles, and also it's because of dead skin cells, which actually also contributes to clogging of hair follicles on the skin and leads to growth of bacteria, which is already present in the skin, like Propionibacterium acne, and other acne bacteria is also there, like lot of QT bacterium acne are there, like acne bacteria are there, and this like leads to inflammation and leads to infection, which actually leads to bumpy appearance of the skin, and that's why this has a lot of negative role in low self-esteem and also in mental health problems. This is a long-term skin condition and it requires a lot of um, uh, consultation and a lot of other treatments. So there are a lot of varieties of acne. The types of acne are also there. Like we have like closed comedones, which is also known as whiteheads, and this appears like white, papular type, and it is closed. Mostly all the hair follicles and skin has been clogged, and there you can see visually that it's a white, and we call it whitehead commonly, but it's also known as closed comedone. Other types are blackhead type, which is already exposed to the upper layer of the skin, and it looks black, and it is open comedogens, and it's also known as blackheads. There are other types of acne also, like there are uh, like cystic acne, which is also like appears large, pustular, and we have uh, uh, other types of acne like combination of abscess, cyst, like we have acne conglobata, that is acne is also there present. So this type of acne is there, and milia is also form of acne because of blocked pores. So these are the types of acne and causes of acne. If you talk about causes of acne, causes
Yes.
is like mainly hormonal changes. Because of hormonal changes, we have lot of acne on our face. It can be because of PCOS, that is polycystic ovarian syndrome, and it can be also due to dietary factors like a lot of dairy products, chocolates, and other oily food. It can also be because of lifestyle habits like an improper diet, improper sleep, stress, makeup, and also because of other medications like steroidal medications, and other unhealthy living lifestyles. So these are the causes of acne, and these are the brief introduction about acne
Right.
and types.
Right. You have very well explained us what is acne, what are the various types, and what are the probable causes of various factors responsible for acne. Now, doctor, the thing is, earlier we used to feel that acne is something that we normally associate with teenagers because of the hormonal changes, etc., that takes place. But nowadays, we see acne in kids, we see acne in teenagers, we see acne in young adults, in adults, even during 40, 45 years of age, people come and say that, see, I'm having acne, and probably they're having acne for the first time.
Yes,
So, yeah, it's there is no age constant any more these days.
correct.
Why it's so?
Because acne is not age related right now. If we really see into it, look into dig in deeper, acne is not at all age related. It's because of lot of environmental factors. It's also because of lot of lifestyle factors. It's not only because of teenager hormonal changes, but it's also now depends upon how you live, how you eat. So that's why it doesn't depend on age. It depends upon what are the factors you are going through, or some of the 40 plus women. If we consider women who are 40 plus, nowadays, they're into too much of skincare, too much of online shopping, a lot of serums they're applying to prevent aging. So these are also factors which are contributing towards senile acne, or let's say old age acne, like or 40 plus acne, because a lot of times it happens that because of the trends also, like a lot of Korean skin steps are coming up, and people apply a lot of layer to layer creams and beauty products. So these are the factors which actually contribute to acne in adults also, and definitely hormonal changes are also another main reason, and polycystic ovarian syndrome is another reason which we suffer in one from the other. Right now in India, a lot of women are having this polycystic ovarian syndrome because of lifestyle problem, improper diet, improper sleep, and lack of exercises, and other stress related issues, like into like lots of women right now are career like career oriented. So these are also one of the factor which leads to hormonal changes and leads to acne in adults, not only teenage but in adults too. Yes, and environmental like climate change, pollution, so these are also the factors playing role right now. So that's why we cannot say that this group, age group, is having acne and this group cannot. So it's not right now well defined right now like that.
Exactly, exactly, doctor. And doctor, who all are at risk? What are the risk factors for acne?
So the risk factor of acne is mostly acne spots, post acne hyperpigmentation, and also scarring. Because once you get acne, maybe it's mild, moderate, or severe, you have the chances of getting hyperpigmentation, post inflammatory hyperpigmentation, PIH, and also you have chances of having scarring, because a lot of times we prescribe medications like retinoids and antibiotics, so which definitely leads to sensitive skin, and you can have a lot of chances and risk factor for acne scars. So that is also preventable, I will tell you in
Definitely, definitely. Let's start about acne first. What are the preventive measures that we can go for, or treatment options available for treating acne?
Okay. So, first treatment option is always visit a dermatologist, your nearby dermatologist. That's the primary, care that you can give, and that's the most important thing that you must do is visit dermatologist and take the prescriptional medications like benzoyl peroxide, retinoids, topical antibiotics, any kind of skincare products like face wash, moisturizer, sunscreen. That has been prescribed by a proper dermatologist. So that's the first step. And other, if you feel, you can actually ask a dermatologist for optional treatments, which is cosmetic treatment like chemical peels, lasers, and a lot of time we have other form of treatments like mesotherapies. You can go through those things, and also another like lot of treatments are coming up in cosmetic dermatology. So you can opt for that after consultation with the dermatologist. Sorry. Yes.
Right. Right, very well said. Because in normal practice, what people do, especially in our society, is they'll first try some home remedies or ask a friend or family, or go to a chemist shop and ask the chemist, to
Yeah.
give some over-the-counter medication. And you're saying that could be really harmful or dangerous. So, first step. The first thing to do is to go and consult a qualified dermatologist. Now, we would like to also talk about the dangerous parts of why over-the-counter medication could be harmful, doctor. To what extent?
Yes, yes, because see, over-the-counter products are not sold by dermatologists. Actually, they are sold by normal, on like I'm so sorry, but their people are not qualified to define that this medication is for this problem, and this medication is good for you or not. They are not able to define. So it's better not to take over-the-counter products, and it can have a lot of side effects, like you can have more severity of acne and later on develop scarring, pigmentation, and also develop sensitive skin, which later on it's very difficult to treat, because acne, you have to have long-term treatment and also skincare. And without any professional help like dermatologist, you cannot actually proceed further, because it's really a very risky thing to do, that is get your own products and just apply and experiment yourself. Experimenting is very bad. So it's better not to take product directly, but after the consultation definitely you may try all the products. And in case of any problem, doctors are ready and able to help you. That's the thing.
Absolutely. And, a doctor will always try to find out the root cause of the problem or acne, but the chemist won't do that. It will not, they'll give, medicines as generalized. They'll not give you as per your individual problem or as per your skin type, etc. So you need to find out the root cause of why you are having acne. So you need to go and consult the right person, which is a qualified dermatologist. And
Correct.
doctor, as we have already, talked about the various side effects of over-the-counter medication and how dangerous it could be, we would also like to understand that treating acne is one thing. Initially, also as you said, acne is one thing, but the hyperpigmentation it leaves, the black scarring that it leaves, and the scars, of course,
Right.
treating those becomes the most lengthier and a tricky thing. Again, the preventive measures for no scarring or no hyperpigmentation after the acne is treated. Anything
Right.
that we can do to prevent it?
Yes, actually, we can do a lot, to prevent acne scarring. First step is always follow a good, dermatological consultation and then prescription. Second is go through proper skincare. That is not pricking and poking and popping your skin yourself. It can be done with dermatologist help. So don't ever try to prick or pop your skin. And if it's necessary, go to a dermatological clinic and do the procedure in a proper hygienic way and clinical way. And other thing is, you must always apply proper moisturizer, that has been prescribed to you to prevent, all those infections, bacterial infections. So always keep a skin barrier like moisturizer, sunscreen to protect from hyperpigmentation, you know. So, and apply them once or twice a day, every time. And other thing you can do is keep your always keep separate towel for your face, and keep hygienic measures like wash your face. People like tell me, doctor, I've stopped using soap, I just wash my face with water. And I think so that is not a great idea. You must always wash your face with gentle cleansers if you can. Otherwise you can use normal face wash if you possible, and keep it hygienic, and other thing is, mm, you must always be safe with your products. Like, do not use products which is which you don't have any idea. Always consult a doctor and use those products, even if it's like prescription medicine or whatever. You always consult a doctor first and then use, so that later you don't have scarring or maybe pigmentation. So this way you can help yourself and prevent from the other side effects that has not been seen because you actually don't have any idea. So that's why you have to prevent all these things, yeah, this way.
Right. And what are the procedures available to treat acne, hyperpigmentation the marks or the scars?
Yes, so we have a lot of treatments right now because it's like advancing, dermatology is advancing into another alternative field, that is cosmetic dermatology. And it's very good for all of us, not only patients, but all of us, because we have chemical peels that helps in exfoliating, that helps in clearing the skin, it helps in pigmentation, and also means to reduce the pigmentation, to reduce acne scars, and also reduce uh, fine lines, and build up collagen. So a lot of chemical peels are there which are derived from fruit acids. These are all fruit acids, and it's really natural, and it's very helpful for acne and acne scars. Another treatment is lasers. So we have types of lasers like carbon fractional lasers, which will actually prevent from further scarring and also reduce the scarring. It will resurface the skin, beautifully, because it's very scientific. Those lasers have got their wavelength, in nanometers, and it goes deeper in the skin and helps to rejuvenate the skin and helps in reducing the scar. So carbon fraction laser is one of the good option. Another option is, if you want to go to economic, prices, if you cannot afford such, hi-fi lasers, then you can go with carbon peel, which is also done by lasers. And other lasers are also there, which are in the market. A lot of things are there, like quick fractional pix laser. A lot of lasers are there, but these are the basic ones, carbon peel, carbon fractional lasers, pico lasers, and chemical peels. You can go with, like, if you have just scarring and acne is not there, then you can go with MNRF, that is micro needling, radio frequency machines, which is very good because you all that micro needles are going under your skin according to the settings. With the, if you want deeper, then you can go deeper. If you want till the surface, it will go till the surface. So you can do the settings in that machine, and you can go through this micro needling with radio frequency lights. And other LED light therapies are also provided in the dermatological clinics. And it's really helpful because it really gives effect on the skin and helps patient mentally, as well as in your physical appearance as a whole. So these are the treatment, and along with that, you can follow prescriptional medicines from a dermatologist.
Right. So we have various treatments, procedures, very advanced procedures which can take care of the marks and the scars. Now, doctor, is skincare plays a relevant role in treating acne?
True. Actually, I may say it's like combination with the treatments. Skincare is like a part of the skin treatment. It's not
Mhm.
primary, but it's part of skincare. So
Right.
you must have a skincare routine not so much like right now YouTube, lot of Google search are there, skincare, five
Yes.
step, four step, but I think minimal, you just have to do minimal skincare, that is keep your face, your hands always clean, and you know always prevent yourself from touching your skin so much. Keep yourself hygienic routine, all the towels, soap, everything you should personalize, you should not share it with others. And even with the makeup, we should not share the makeup with other people. We should keep our personalized makeup kits and all, and use minimal makeup and minimal skincare, which will actually help you to feel really healthy inside out. And use of cleansers, moisturizers, sunscreen, and yes, serums are there. Salicylic serum for acne is very good in combination with retinol serums. And other serums like niacinamide, vitamin C are also there, which is helpful. But you must always, use these products under proper instructions according to the doctor. So it's very important, yes.
Right. So for the skincare regimen, as you said, basic few hygiene things are there. Plus the products like a cleanser, a moisturizer, sunscreen, or some serum. Again, we need to go and consult the dermat so that we get the right product, right, as per our skin type, etc.
Correct.
Now, there are, few things or complaints or myths surrounded with these skincare regimen. With acne-prone people or people who have, oily skin type or combination skin type, they'll often say that I keep on, washing my face again and again, every now and then, so that, it's oil-free. And oil-free means acne-free. Is it true or it's a myth?
Uh, I'll tell you, uh, it's like washing too much face is not good. It's good to wash face. I'll tell, it's good to wash face 2 to 3 times, but excessive washing actually leads to, signal our brain that our skin is getting drier, and then it will again lead to oil production. So that is actually a myth that you should wash so many times, it's
Mm,
excessive. So anything in excess is bad. So
That's right.
always follow 2 to 3 times. Otherwise, 2 times is, it's okay to wash your face. 2 times is okay. Otherwise, 3 times. Because in India, a lot of pollution is there. So maybe 3 times is okay, but excessive washing is not great because it leads
Okay.
to more production of oil. Yeah.
Fair enough. And with moisturizer, again, they'll complain that, see, I already is secreting so much of oil. Why do I need to moisturize? Many times, acne prone skin people or people with oily skin do not have moisturization in their, skincare regimen because they
Correct.
feel they are already secreting so much of oil. Why is moisturizer important for them?
Uh, See, moisturizer is important because it helps to give you skin barrier, because while you're applying lot of other topicals to treat acne, you must actually also see that your skin is not going sensitive, because a lot of drugs are used, chemical, topical, and lasers, all these are used to prevent acne, to reduce acne marks, scars. So to protect it, we must moisturize, because moisturizer, what it does is it helps to layer the our naked skin and have a barrier, skin barrier, and all that later on, which gives you rough skin or sensitive skin, or maybe flaky skin because of retinoids, it's all prevented. So it's a first line skin barrier. Therefore, you must use moisturizer, and there are very various types of moisturizer right now according to skin type. I mean skin condition. Like if you have oily skin, there are a lot of moisturizer which are lighter, and for drier skin, you have a lot of moisturizer which can be with combination of lot of ceramides, and it will give your skin really, moisturized. So you have to always take care that you must apply moisturizer whenever you even if you are not having acne, you must moisturize your skin according to the types, according to the condition, like oily or dry. Use
Right.
light moisturizer for the oily ones. Yes.
Right. And again, with sunscreen, people with acne or who have oily skin will complain that it
Yeah,
makes me sweat a lot, or it makes my face looks very patchy or dull. Or why should I layer up my acne with sunscreen? There are so many myths associated with sunscreens.
correct,
What's your
correct,
take on that, doctor?
correct. Actually, that is also a good question, very interesting and good question, because a lot of my patients come and when I prescribe sunscreen, they say, "Doctor, please don't give me sunscreen. I feel very bad to use sunscreen because my face is already bad." So I feel like, I should explain them. So I explain them like this, like I'm explaining right now. I explain them that why sunscreen is necessary, because sunscreen is also our skin protection, like we are using sunscreen as a mask because a lot of pollution is around us, and also we are using a lot of other products, like especially in acne when you use retinoids, it's like already, it's guaranteed their skin is going to be sensitive. So in that case you have to use sunscreen because you have to protect your skin from other hyperpigmentation issues. But generally, even if you don't have acne, you must apply sunscreen, which actually leave you with wonderful skin beneath, because it's protecting you from UV radiation, which we cannot see with our naked eyes. Even with mobile phones, we are getting blue light radiation, and it's emitting, all the laptop lights are emitting radiations. So it's protecting our skin directly or indirectly. So that's why sunscreen is important. However, if you are feeling patchy skin or very, dull skin because of the sunscreen, you must always prefer sunscreen which are in a matte form or a gel form. So right now, all the sunscreen has been developed in a very beautiful way from different pharma companies. So you have various type of sunscreen for oily skin and also various type of sunscreen for dry skin. So I think drier skin can use sunscreen which has got niacinamide, hyaluronic acid. And if you have oily skin, then you can also use sunscreen which has got vitamin C and also silicone based, or matte form. So, or maybe if you have a lot of spots on your face and it looks dull, you can have tinted sunscreen, which is consisting of titanium dioxide. So these are various sunscreen which you can actually get it perfectly prescribed by a dermatologist who knows better. Yes.
Okay. We have a similar question from Gopal Naidu. His question is, can sunscreen help prevent acne marks from worsening?
Yes, definitely. It helps, It doesn't treat, I mean, it doesn't cure, but it will help you to prevent from further marks and further scarring or something like that. And it will give you skin protection from further damage. Yes, sure. It is
I have
true.
seen many a times, most of the times, that when a doctor prescribes some or do some procedures, or in the process of treating the acne, they'll always prescribe a sunscreen. So,
Correct.
how important is sunscreen for as the treatment part, or during procedures and all, lasers and all?
It's very important because after treatment, always patient has got 90% of chance to get PIH, that is post-inflammatory hyperpigmentation, because something is going in your skin. Maybe it's laser or chemical, it's going underneath your skin, and you need to protect it from further damage. So that's why I always tell my patient that like 3 दिन मुंह मत दिखाइए. Like I say them to stay at home, to stay, away from sun, or else if you are really a professional person who needs to go out in sun, then wear a mask, which is comfortable to your skin, and wear a sunglasses or a hat, because it's very important, because something is going in your skin, and it's really actually now remodeling your skin, so something has gone and it's remodeling the skin. You need some protection to preserve that. So that's why sunscreen is very, very important after procedure also. Yes.
When we go to buy a sunscreen, doctor, there are so many informations on the box or the
Yes.
tube, right? Starting from the SPF to the boot star rating to whether it's broad spectrum or not. What are the basics to go for, especially for acne prone or oily skin
Yeah.
type people? What are the basics?
Okay. So while you go to purchase sunscreen, you just look for physical sunscreen most of the time. Don't go with all that chemicals that is there, all benzoate, octacrylene, all those are there, which means I feel it's okay because they have been pharma, especially sunscreen from pharma companies. What they do is they know how much dose it should be there, But most of the sunscreen which are over the counter, we don't know how much dose they have put, how much ingredients are there, which kind of chemicals are there. That's why always, if you want to go for first time with a sunscreen, go for physical sunscreen, and that is consisting of titanium dioxide and zinc oxide. And then later you can choose, that add-ons like niacinamide, vitamin C. So these are the sunscreen you should look for. And if you are getting sunscreen between 30 plus or 50 plus, then it's okay, fine. But sunscreen mustn't be so much greasy or mustn't be too much sticky, because it might always give patient a dull look. So always go for lighter sunscreen. That is better, and apply 2 to 3 times a day. That is the best thing you can do. Yeah.
Right. So we should get that feel good factor, right? And yeah, it's true. When you find out ultimately the, perfect sunscreen for you, you feel it's the best thing that happened to you or your skin, because sunscreen actually makes you feel really good. So that feel good factor is very
Yeah,
important. And
correct, correct.
Dr. Again, the amount of sunscreen to be applied, how many times it should be applied, the reapplication part, and all these matters. Please, we would like you to shed some more light over it.
Yeah, so definitely you have to see, how much you can apply and how many times. You must see that. So we have rule of two fingers. So every time we dermatologists like to use our two, like, two rules. That is two finger rule. That is, we have to apply a tube or pump 2 times, on your 2 fingers, and then you can apply it this way. Just dab it and all over the exposed part and then rub it. If you require more, then for other parts of the body, then you can again apply with another 2 finger rule. So that is the thing. And another thing is, you must apply 2 to 3 times, because India is really tropical climate, and we don't know, like, when it's humid, when it's hot, we don't know, and when it's rainy, we have all kind of season. So always
Mhm.
make sure that you apply sunscreen indoors and outdoors, even if it's summer or winters. But make sure that what kind of sunscreen you want, whether it's matte form or maybe it's little bit moisturized form. So you have to check that, and to check, you must again go to the dermatologist and do that. Otherwise, you just make sure that it's suitable for your skin, and just try out. Yeah.
Right. Many times the acne prone people or people who are having acne will ask that, can I use makeup
Makeup.
during acne with acne?
Big no. Actually,
Okay.
I feel like
But again,
what.
because there are so many
Yes.
professions where
Yes.
makeup is must, right? It's a necessity. What
Correct.
to do?
So see, if like, yes, some air hostess, they come to me and they ask me, madam, actually I have a lot of problem because I have to apply makeup. I'm a model. I have to apply makeup. So what can I do? So I tell them, I always request them to apply a proper serum. Maybe it's niacinamide or vitamin C at first, after washing properly or cleansing properly, and then use moisturizer and sunscreen. Then they can use the other foundation or maybe powder they want, and then they can good they feel like that they can, okay, they can have this kind of makeup on. Then they can, like, do this thing, this routine, that it's good to go. But apply moisturizer, sunscreen, serum first, then apply makeup. And before you come back and do the nighttime skin routine, always make sure that you clean, double cleanse skin. That is, first you remove your makeup, and then you actually wash your face or cleanse your face, then apply good amount of serum and moisturizer, and then go back to sleep. So these are the things they must take care. So if
Right.
you have no option, you can take these tips. Yeah.
Exactly. And any dietary precautions or do's and don'ts for people who are prone to acne or are having acne?
Yes. Dietary products always should be avoided, like milk, fatty food, like fried food, which we love actually. So we have to avoid those. Like refined products, like refined sugar, refined wheat, all those things we have to avoid, like maida. And always take plant-based milk. If you want to take milk, if you are a vegetarian, then take plant-based milk and soya products, if possible for you, if you are able to digest that. Yogurt is very good for your skin, so you can have yogurt. And definitely green vegetables and fruits are best friends. They consist of antioxidant vitamins, so you must take those things. And always eat on time, sleep on time, exercise. These are the great thing which we can do, which we can try. Yes.
Right. So lifestyle changes also play
Yes.
Big role. Okay, so Kirti Kapoor is here. Her question is, I
Hello.
want to know that how affecting are topical treatments for acne scars.
Uh, Topical treatments are effective, but not that much like how now it has progressed into cosmetic dermatology with lasers and chemical peels, But it is good way to start to prevent your acne scarring. Like we have retinoids, bunch of retinoids we have in the market, which are prescribed by dermatologists. Don't use, just like that, but prescribed by dermatologist because it has got percentage. Those percentages are there 0.5, 1%, 2%, So you have to use very, very carefully because all the topical retinoids are not stable for all skin type because it can flare up your acne again if you don't use it wisely. So you have those kind of treatments, yes, in the market, in the pharmacy department, but you have to always consult a dermatologist before using them. And it's good product for acne scars. It will help to prevent and also reduce somewhat, reduce the acne scars. Yes.
Right. And doctor, what's your take on home remedies? We love doing home remedies on our skin, on our face specifically. Even with acne, we like to put something on the acne.
Yes,
Many
right.
times cinnamon or garlic or anything. How good or bad would it be?
Garlic, I don't understand, but I can tell you home remedy. One of the home remedies which I also use sometimes is if you can have a coffee scrub, which is good for your skin to exfoliate sometimes, maybe in 10 days or maybe once a week, according to your, how much oily your skin is. It's good for oily skin, coffee scrub. Okay. And turmeric is also very good for your dark spots and all, which you can combine with coffee and all. And it's great for your coffee eyes also, that coffee mixture, turmeric powder, And other thing I can say, suggest is if you can purchase, it's better to purchase clay green tea mask, which you get over the counter, or you can make it yourself if you have green tea products and all. You can make it yourself. You can make a green tea mask and apply on your face. It helps to reduce inflammation. So usually, what I do is whenever I get acne and all, I use green tea mask, which is available easily everywhere in the market, and I use them, and it's a clay form and it helps to reduce the inflammation. And definitely it helps a lot in oily face. Yes.
Right. And doctor, before we sum up the whole session, any take-home message for our viewers?
So my home message is don't worry so much because acne is a long-term skin condition and it does definitely I understand that it helps it actually affects your physical well-being, mental well-being. It takes time to heal, but don't stress on that. Always visit a proper dermatologist, get a proper prescription and treatments, and always take care of your hygiene, of your lifestyle, and stay happy and sleep well. That's my give message. Yes.
Thank you so very much, doctor. It was wonderful talking to you. Thank you so
Thank
very
you.
much
Same here.
for such an informative session. Thank you.
Thank you so much. Thank you.
And viewers, thank you for your active participation. Stay happy, stay healthy, keep following us, and stay beautiful, keep glowing. Thank you. Goodbye. Good day.